Hey, welcome to my channel. My name is Christina. I am a family nurse practitioner, and in this video I will share a live demo of how to instill eardrops in the adult and pediatric child less than 3 years of age. So let's get started. Eardrops are administered in the setting of an ear infection referred to as otitis media or otitis externa, also known as swimmer's ear, which is this painful infection of the outer ear. Or they may need eardrops in the setting of earwax buildup to help soften the cerumen, as cerumen is referred to as earwax. So your patient will be prescribed a medication. Prior to administering the medication, you want to verify the 6 rights. So you can remember the 6 rights as a phrase. I made up this little term. What I think to myself is the patient's medication dose was timed for the route and documented, meaning, so these 6 rights would include the right patient, the right medication, right dose, right time, right route, and right documentation. This helped me tremendously remember the 6 rights. So I made this into a phrase to help me remember the steps when administering medication safely for patient care. So prior to administering, you always want to make sure you wash your hands and glove. So to instill eardrops for the adult patient, have them lying on their side. You pull the pinna of the ear up and back and straighten the ear canal and instill the number of eardrops ordered. And you want to gently massage the tragus of the ear, allowing the patient to rest for a few minutes to allow adequate absorption. What helped me remember the adult version of this technique, I always think an adult is taller than a child, so I will pull the ear up and back. Now to instill eardrops for the pediatric child less than 3 years of age, have them lying on their side. If not feasible, you can tilt the child's head in the opposite direction. With the help of the parents, you will gently pull the ear down and back and gently massage the tragus of the ear. If reasonable, keep the child comfortable lying on their side to allow for the eardrops to absorb adequately. What helped me remember the child's version of instilling eardrops, I always think of a child is shorter than an adult, so I will pull the ear down and back. Again, thank you so much for watching. Be sure to subscribe for upcoming notifications. Take care.